A pleasant day. My name is Trixon Madrid, a second-year college student of Radiologic Technology. And for today, I'm going to perform vital signs, also known as Cardinal sign, where vital sign, this is an important factor or part of physical assessment, which includes the measurement of body temperature, pulse, respiration, and blood pressure.
Body temperature is the physiologic balance between heat produced in the body tissues and heat lost to the environment. I am using a forehead thermometer for my patient on the left, which provides a quick and sterile way to assess an individual's temperature. This was essential use during the midst of pandemic, and her body temperature was 36.4 Celsius degrees. And I am using a digital thermometer for the patient on the right because it is quick to use and reasonably accurate. There is actually different kinds of thermometer, where thermometer is a device that measures temperature. And this body temperature was 36.3 Celsius degrees. The both of them are in a normal body temperature since it ranges from 36.5 to 37 Celsius degrees.
Next is pulse. Remove any accessories from your patient's wrist so it won't hinder us to palpate the pulse. Pulse, it refers to as the advancing pressure wave in an artery caused by the expulsion of blood when the left ventricle of the heart contracts. There are different pulses in the body where we can get the BPM or beats per minute of our patients. Radial pulse is my preferred choice for locating the pulse of my patient. We can find the radial pulse in the wrist, in the radial artery, or side of our thumb.
My patient on the left side has 73 BPM and my patient on the right side has 84 BPM. Respiration is the process by which organisms exchange gases, especially oxygen and carbon dioxide, with the environment. To know the respiration rate of my patients, I am counting the number of breaths for 1 minute by counting how many times the chest rises. My patient on the left side has 14 respirations per minute and my patient on the right side has 15 respirations per minute. The both of my patients has a normal respiration since the normal breathing rate for adults ranges from 12 to 20 respiration per minute. To conduct a blood pressure, roll up the sleeve of your patient's clothes if needed. By the use of sphygmomanometer and stethoscope, we can identify the measurement of blood pressure. Put on the cuff, not too tight and not too loose. To measure the tightness, put 2 fingers inside the cuff to test. Clip the pressure gauge on the cuff and find the pulse below the cuff and put the stethoscope. Blood pressure refers to the amount of blood flow ejected from the left ventricle of the heart during systole and the amount of resistance the blood meets due to systematic vascular resistance. Get the bulb and close the valve to prevent the air escape from the cuff. Press the bulb until the needle reaches 180 to 200. Open the valve slowly to release the air. Remember that the first loudest beat is the systole and the last quiet beat is the diastole. My patient on the left side has 110/80 and my patient on the right side has 100/65.